We are going to start this lesson by looking closely at the first 2 years of development, known as infancy. Infants and toddlers, or children beginning to learn to walk, are the subject of this lesson. First, let's explore the dynamic physical growth that occurs in this time period. The average newborn weighs about 7.5 pounds. Most infants range anywhere between 6 and 9 after birth. After a few days of moderate weight loss, mainly because of expulsion of waste and getting used to feeding, the infant starts to grow rapidly and usually doubles in weight by 4 months. The birth weight is tripled by 12 months, so a 7-pound baby now weighs approximately 21 pounds. Most newborns are between 19 and 21 inches in length and an average about 20 inches. The typical 2-year-old is 32 to 36 inches in height. There is a dramatic change in the body proportions during the first 2 years. A newborn head is about 25% of its entire length. By adulthood, however, the head is proportionately smaller. While we may notice a lot of change happening outside of the body, incredible growth is happening within the first 2 years. The brain is 25% its adult weight at birth, and by age 2, it's grown to about 75%. Much of this growth takes place in the dendrites, or the branch-like extensions coming from the neuron. These are the point of entry for chemical messages that are picked up from the surrounding neurons throughout the synapse. This growth reaches its peak at age 2, and then connections that are not being used are basically pruned away to increase the efficiency of the remaining connections. In this way, experiences begin to shape our hardwiring. Myelin is a fatty substance that coats and insulates the axon of neurons. It speeds up the rate of transmission of the neural impulses and improves functioning. Myelination, or the insulating process, is also occurring in infancy and continues at least rapid pace into adolescence. Not all parts of the cortex measure at the same rate. The prefrontal cortex, located behind the forehead, is the last to mature. It is not fully developed for years to come. We'll look at how it goes through the second period of growth in adolescence. So when we talk about motor development, what we're actually talking about is movement. And when we are born, we are equipped with a number of automatic responses to stimuli known as reflexes. We're not really controlling that. These include a sucking reflex or even a palmar grasp, basically strongly clasping the hand around anything touching the palm. So you ever reach out to a baby and then they start to just instantly kind of grab your finger? Those are some of those instant reflexes that they're going to start building over time. After a few days or weeks, reflexes begin to be replaced with voluntary movements or motor skills. These skills are not mastered in infancy, however. Motor skill development continues throughout childhood. Gross motor skills are large movements of the body that require large muscles, such as those located in the backs, legs, and arms. And so a lot of times you see people practicing calling tummy time, where they turn that baby around so then they can start practicing some of that development of their motor skills. So fine motor skills are smaller, more precise movements of the hand and finger. These take much longer to acquire because they involve the ability to coordinate the hand and the eye and being able to manipulate the hands to grab and move small objects. The newborn senses are not equally developed at birth. Vision is the least developed sense when they are born. If you were an adult and if you saw like an infant, you would be considered legally blind. Newborns can only focus on objects between about 8 and 16 inches away. They can't see very far, and they have a really hard time scanning objects and tracking movements. Their ability to focus on both eyes on an object is called a binocular vision. It begins around 14 weeks, so they really can't see you from far away. They can see contrast, but they have a really hard time distinguishing hues that are similar, and this doesn't develop until a few months later. Hearing, however, is developed at birth. Breast milk is considered the ideal diet for newborns. The calories and the nutrition provided are perfectly suited for infants, And what a lot of times what's happening is the body is responding to the needs of the child without sometimes you even being aware of it. There are numerous advantages of breastfeeding. They include providing immunity and decreasing the risk of infection in the newborn child, and it's free. However, not everybody can breastfeed. Sometimes women are limited just by their body and their ability to produce milk. And mothers should avoid breastfeeding if they have HIV or untreated tuberculosis, if they're using obviously drugs, or if they're undergoing like radiation and chemotherapy treatment, they should not be breastfeeding. Next, we're going to explore cognitive development, and we're going to focus on language acquisition and changes in the ability to think and reason. Piaget's stage for infancy is called sensory motor intelligence, and you just have to remember that infants use their senses and their motor skills to explore and to experience the world. So just remember there are 6 stages of sensory motor intelligence. The first stage, the infant is focused primarily on their body. The first stage is really found in the first month of life. This is a time when reflexive action is used to react to the world. So newborn has few mental concepts at this time outside of like sucking, chewing, rooting, and or other automatic movements. If any object is placed near the mouth, the infant may turn and begin to suck on it. The infant may cry if that object is like sour or otherwise brings about kind of discomfort. Stage 2 lasts through the 4th month of development. Now, the infant is making like adaptations to the environment, so that sour object, they now recognize it as maybe something to avoid rather than just suck on it because it's right there. A new schema is built throughout the process of like accommodation. Stage 3 is called repeating actions, which lasts about 4 through 8 months of development. The infant begins to repeat actions to see what the effect this might bring. So shaking a rattle, repeating a syllable, or rocking back and forth are an example. The child is increasingly interacting with others in this stage. So now they're not only focused primarily on their body, but they're also focused on the world around them. Stage 4 lasts from about 8 to 12 months, and it's a time of new adaptations, and anticipation is the key word. The baby begins to look forward to events that they enjoy, like taking a walk or maybe even a bath. The signals being able to consider the future. So the baby's starting to anticipate things. Piaget suggests that object permanence, or the knowledge that an object continues to exist even if it cannot be seen, is acquired at this stage. So basically, prior to 8 months, the baby who's shown a toy and then blocking the toy from its view basically loses interest. Piaget concluded that babies think it no longer exists because it's out of sight. After this age of about 8 months, the baby will remove the barrier and seek the toy that is out of their view. But infants at a much younger ages respond to events that do not seem to be possible. So let's say an infant is shown a fuzzy red square moving behind a screen, and when it comes back, it's a yellow circle. They're going to look at this event for a long time and recognize this should have not occurred. The red square that moves behind a screen should still be the same when it appears. And so they're really trying to make sense of what is appearing before them. Stage 5 is the stage of experimentation. This happens in stage 5 and 6, and the child is really busy interacting with the world and making discoveries. Most of these discoveries come in form of trial and error in learning. The child learns about gravity by letting objects drop, or the child learns that pulling on a dog's ear brings about a cry. This trial and error learning can be very messy, as pots and pans and household items are pulled out of the shelves and contents are spread all around. But this is the way that they're interacting with the world, so they can start making sense of what they're seeing, what they're hearing, and what the reactions are from people and things. So the last stage is this part where they're making a transition to thinking in order to actually solve problems. And what they do is they're using a combination rather than solely relying on trial and error to solve the problems. This requires them to see something and then imitate it at some point later on. So they're almost storing this information of how to resolve issues. So here's an example. Let's say a child wants to get out of a room, but they can't grasp the doorknob. After trying to open the door, the child decides to use a technique that they remembered witnessing before, and they knock on the door. And that brings someone to the door and they open it. So let's look at how communication develops in the first 2 years. The question is, can newborns communicate? Yes, of course, but they use cries, facial expressions, and body posture to do so. When a baby is between 2 and 3 months, they begin to make intentional vocalizations such as cooing or squealing. They laugh and they also learn the pace of speech by taking turns in communication. Deaf babies also vocalize at this stage, actually. Gesturing is an easy way for babies to communicate. At 5 months, the baby points to objects, shows frustration and delight by waving the arms. Gesture is so natural to infants that learning sign language has been seen as an effective way to enhance their communication skills. At around 6 months, the infant begins to babble. Babbling is typically a vowel consonant combination repeated over and over, like na 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 or ga ga ga. They are precursors to language, and gradually only those sounds that are used will be retained. So what they start to realize is like babies start to like tune out sounds that they don't recognize. And so if you're like a native English speaker in your home, they start to tune out language that they just don't understand or don't commonly experience. Deaf babies also babble at this stage with gestures that partially indicate like a concept or a thought. So our understanding of language seems to come before our ability to articulate the language. So what that means is understanding comes before speaking. So if any of you study the language, chances were that you were able to understand it before you could actually form sentences in that language. For most babies, the first spoken word seems to emerge around a year. The baby uses whole speech for a single word to convey the entire thought. So, for example, a baby might say like "juice," and that might mean "I'd like some juice," or like "Where's my milk?" Right? The meaning has to be interpreted by the listener, and this can be very difficult if you haven't been around that baby. So sometimes that's how like a parent understands what the baby says, but if you're visiting, you're like, I have no idea what this baby's saying right now. Once a label is learned, the baby may underextend or sometimes even overextend the use of the label. So, for example, my mama may be only referred to the child's mother, or doggy may be used to describe all four-legged animals in the zoo. So it just depends on how they're using it. Typically at this age, they should know about 50 words. English-speaking children tend to have many nouns or labels for objects. And for deaf babies, their vocalization may disappear by age 2. At 18 months, there is a big vocabulary growth spurt. Toddlers will use more and more to and word sentences that make them easier to understand. Eventually, they get to a point where they're using like 3 to 5 word sentences. And what it's referred to is telegraphic speech because it reads more like a telegraph. Unnecessary words are eliminated. So many people are unfamiliar with telegraphic speech today, but texting is like similar. So I call this like text message speech rather than texting like, hi there, how are you? What's been going on with you? Somebody might just text, what's up? So you get the idea of like they're using words to convey it, but not as many. Have you ever seen a person talk with a baby or you yourself? Typically, your facial expressions and your intonation change, so they begin kind of like a sing-song talk known as child-directed speech. It goes something like this. Do you like mommy's pretty beads? Why do people do this? It's because it gets the baby's attention. Babies respond to this type of speech in which vowel and consonant sounds are exaggerated, and when pitches go up, you may have responded to in that instance. So there are a couple theorists when it comes to language development. The most famous linguistic is Chomsky, which he suggests that our ability to learn language is inborn. We have a neurological construct in our brains known as language acquisition device. Learning language is simply a matter of being exposed to a language. Skinner suggests a language is taught throughout reinforcement by the parent or the caregiver. A child is given praise and hugs for uttering a word, and this increases the likelihood that this will be repeated. Our final angle for understanding infancy is the psychosocial development. So let's examine emotions and relationships in the first 2 years of life. So newborns can demonstrate a number of different emotional states. One of their first one is attraction and withdrawal. And what that means is they respond in order to get closer to people and situations or to move away from them. One of the things that we start to see is social smiling, and it begins about 2 months of age. The infant returns a smile and a connection seems to be have made. And while infants can imitate facial expressions like earlier than that, social smiling is a reaction to seeing somebody else. Babies laugh at about 3 to 5 months of age, and they can demonstrate other emotions like fear, anger, and sadness a couple months later. There was an interesting study that was done in which they recorded a baby's reaction as their mother paid attention to a doll and ignored the baby. And the study suggests that babies can feel jealousy as early as 6 months of age. Once infants become more cognizant of those around, stranger wariness and separation anxiety can emerge. Stranger wariness is this discomfort a baby feels when being held or surrounded by strangers that they're not familiar with. Separation anxiety can be expressed through like cries and protests when a caregiver leaves. Not all babies experience these emotions to the same degree, to the same level, but they're usually interpreted as a sign as an attachment has been formed between the baby and the primary caregivers. So self-awareness and self-recognition is seen at around 15 months of age. This is understanding that the image in the mirror is you. So the classic test of self-awareness for like a baby would be is if you were to put like a little dot on their nose and then put them in front of a mirror. A baby who tries to grab the nose in the mirror does not recognize the image as themselves, but the baby who starts to rub the dot off their own has self-awareness or recognition. So for many animals, they may not achieve self-awareness. So like some dogs, when they like see themselves in a mirror, like they start to bark because they don't understand that it's them. But then there's other animals like a parakeet who could recognize themselves and just like fall in love with who they are, right? A sense of self leads to the development of like social emotions such as guilt or shame or embarrassment. These emotions require the ability to see how others might view one's own action. An attachment is a desire to be close to someone else. Early attachments between infants and their caregivers have been the subject of a lot of research. The assumption have been made that early relationships set at the stage of subsequent relationships. These relationships can influence later relationships, but they do not dictate the future. The most common type of attachment is called secure attachment. This is thought to be developed if the child receives care and affection early in life. This leads to a sense of trust and curiosity in early childhood. The child will feel confident and explores the world while still feeling safe and secure. Again, the presence of separation anxiety may signal that an attachment has been formed. One type of insecure attachment style is called insecure resistant. And this style may result from inconsistent care, which sends the message that needs can often go unmet. The child may be clingy and can never receive enough attention to feel okay. The child may fear being alone and worry that the caregiver will leave even when in their presence. The insecure avoidance style of attachment is one which the child does not seek comfort or care from the others. The child is neither curious nor clingy. Rather, a child may seem to be precautiously independent. The child is uncomfortable with the closeness. The least common style of attachment was described after viewing the interactions between mothers and with schizophrenia and their children. The disorganized style of attachment doesn't seem to make sense in a given situation. The mother may have laughed when the child was upset or grown angry when the child was happy. The child may cry or be combative with others during play, or they may freeze or retreat in social situations. The behavior is basically unpredictable and emotions are inappropriate for the setting. Attachment styles show cultural variation, so this suggests that cultural expectations find their way in parenting practices and in the attachment style. A lot of research suggests that children aren't born with personalities, but they demonstrate differences in temperament soon after birth. And what temperament refers to are inborn behavioral tendencies. They are fairly consistent in ways of relating to other people and situations, and they aren't shaped by parenting styles. They may be there may be like tendencies that are interpreted by others, and then later it gives rise to someone's personality traits, and we can view that in ourselves. So, for example, a baby who's very predictable may be labeled as a good baby, and this view may later be internalized into their own self concept and part of their personality. In the 1950s, there was this New York longitudinal study, and it was an effort to monitor the differences between children and keep track of those differences throughout a long period of time. And what they were looking at is they were really looking at the qualities of temperament. And so the first one is really about the activity. That means like how active is the baby? And then when we go into the rhythmicity, does the baby follow a routine of regularity? Do they want to eat and sleep at the same time? The approach withdrawal asks the question, how does the baby respond to others? And adaptability means, can the baby easily adjust when situations change? Intensity means how intensely does the child laugh or cry or react to situations? What is the child's mood? Is it consistent or does it fluctuate? Does the baby tend to stay on task and focus? Is it easy to distract the child from activity? Does the baby react strongly to changes in food textures, light, or sound? So from these questions in the study, they basically created this dimensions of temperament. And what they did is they created like temperament types. And so the way they would describe children is like the easy and flexible child is adaptable and shows a consistent, like pleasant mood. A difficult and active or feisty child reacts intensely to change and routine, and they have like a wide variation in mood. And the slow to warm up or cautious child, they tend to withdraw from others and they may dislike disruptions in their routine. The thing is, many children are difficult to categorize in these types, but knowing a child's temperament can be really useful in dealing effectively with a child. So, like parenting styles that match temperament, it can work really well, and they're known as like goodness to fit styles. Erickson's first psychosocial stage of development is called trust versus mistrust. The dependent infant has to rely on others for survival and stimulation. If the baby is given consistent love, care, and a sense of trust, it develops. If not, the child may feel insecure and worry that their needs will go unmet. What kinds of situations might undermine the establishment of a sense of trust? Maybe like parents who are unaffectionate or resentful about the baby, or who are preoccupied with the discord in the relationship, or maybe they're unavailable or tense and may convey this in their interaction with the child. An early stressful environment can have an impact on the neurological development, making the child more sensitive to like stress in the future. Establishing trust requires adequate care, sufficient oral stimulation through like sucking and physical contact, and an overall message of care. In the second year of life, children become able to walk and talk and explore. Erickson suggests that the primary concern is that of independence and autonomy and like self-rule. They need to be allowed to be independent within obviously safe limits. Performing a task or seeing the end result can give a child a sense of pride in their accomplishments. And this like self-evaluation is more effective than having others say, I'm so proud of you. It's really when they're able to carry out an act is when they actually feel that self gratification. In our next lesson, we're going to focus on early childhood.